1. Which principle best supports adult learning in transplant coordinator education programs? A. Memorization of facts. B. Learner self-direction. C. Passive lecture. D. Standardized testing. 2. In evaluating a clinical transplant coordinator's performance, the most effective approach is A. Oral recall only. B. Multiple choice exams. C. Simulation-based assessment. D. Peer popularity survey. 3. Which curriculum development step ensures alignment with regulatory requirements in transplant coordination? A. Brainstorming topics. B. Identifying learning objectives. C. Creating colorful slides. D. Reviewing attendance lists. 4. The most effective communication strategy when educating a patient about transplant risks is A. Using complex medical terms. B. Delivering information in one long session. C. Using plain language and visual aids. D. Asking them to research independently. 5. When mentoring a new transplant coordinator, the mentor should A. Assign tasks without explanation. E. Model best practices and provide feedback. C. Focus only on written guidelines. D. Limit opportunities for hands-on learning. 6. Which adult learning theory emphasizes connecting new knowledge to prior experience? A. Behaviorism. B. Constructivism. C. Cognitive dissonance. E. Operant conditioning. 7. Which evaluation method provides the most comprehensive insight into a coordinator's clinical reasoning? A. True-false test. B. Case study analysis. C. Short answer quiz. D. Attendance record. 8. When designing transplant coordinator training modules, the first step should be A. Writing exam questions. B. Identifying learner needs. C. Selecting textbooks. D. Scheduling classrooms. 9. In regulatory compliance, the primary goal of documentation in transplant coordination is A. Increase workload. B. Demonstrate adherence to standards. C. Entertain auditors. D. Track staff attendance. 10. Which communication approach ensures effective collaboration between transplant team members? A. One-way announcements. E. Closed feedback loops. C. Active listening and open dialogue. D. Silent observation. 11. Which instructional strategy is most effective for adult learners in high-stakes clinical environments? A. Passive note-taking. B. Problem-based learning. C. Memorization drills. D. Group chanting. 12. The best mentoring approach for supporting professional growth in new coordinators is A. Strict evaluation only. E. Providing constructive feedback. C. Ignoring mistakes. D. Overloading with tasks. 13. Which evaluation method helps measure a coordinator's ability to apply transplant protocols in real settings? A. Objective Structured Clinical Examination, OSCE. B. Essay writing. C. Fill-in-the-blank test. D. Attendance log. 14. In adult learning, intrinsic motivation is best fostered by A. Linking content to professional goals. B. Mandatory rote assignments. C. Ignoring learners' preferences. D. Punitive grading systems. 15. What is the primary role of curriculum mapping in transplant coordinator education? A. To increase lesson length. B. To align learning outcomes with objectives. C. To make classes less structured. D. To satisfy faculty preferences. 16. Which communication barrier most affects transplant education? A. Cultural sensitivity. B. Medical jargon overload. C. Patient motivation. D. Coordinator certification. 17. Which mentoring practice supports knowledge retention and clinical coordination? A. Encouraging reflection. B. Providing only oral lectures. C. Assigning random tasks. D. Ignoring learner questions. 18. The purpose of formative evaluation in transplant coordinator training is A. Summarize total learning. B. Improve ongoing learning processes. C. Replace certification exams. D. Avoid regulatory audits. 19. Which adult learning strategy is most effective in teaching ethical decision-making in transplantation? A. Group case discussions. B. Lecture memorization. C. Silent reading. D. Automated testing. 20. The principle of confidentiality in patient education primarily serves to A. Protect legal compliance. B. Improve exam scores. C. Encourage open communication. D. Simplify paperwork. 21. When building curriculum, Bloom's taxonomy is applied to A. Rank staff performance. B. Structure learning objectives. C. Assign grades. D. Train only mentors. 22. Which is the most effective evaluation tool for assessing critical thinking in clinical practice? A. Scenario-based assessment. B. Vocabulary quizzes. C. Timed fact recall. D. Attendance certificates. 23. Which regulatory body primarily oversees transplant coordination compliance in the U.S.? A. CMS. B. FDA. C. OSHA. D. CDC. 24. The most important aspect of communication with transplant patients is A. Delivering information without dialogue. B. Ensuring understanding and engagement. C. Using only written consent forms. D. Avoiding sensitive topics. 25. Which adult learning strategy uses real-life challenges as teaching tools? A. Drill-based memorization. B. Experiential learning. C. Silent reading. D. Dictation practice. 26. The best mentoring approach to promote professional autonomy is A. Step-by-step micromanagement. B. Encouraging decision-making under guidance. C. Assigning repetitive tasks. D. Avoiding critical feedback. 27. Which evaluation type ensures training meets regulatory requirements? A. Summative program evaluation. B. Pop quizzes. C. Informal conversations. D. Peer popularity ratings. 28. Which factor most enhances knowledge transfer in adult learners? A. Immediate relevance to job tasks. B. Random unrelated topics. C. Overly theoretical material. D. Monotone lectures. 29. Which communication technique is best when discussing sensitive transplant outcomes with families? Avoiding eye contact. B. Using empathetic listening. C. Giving brief yes/no answers. D. Delegating to administrative staff. 30. Which curriculum design model is most widely used in healthcare education? A. ADDIE. B. Linear. C. Spiral only. D. Open-ended. 31. A mentor best fosters reflective practice by A. Encouraging journaling and discussion. B. Giving orders only. C. Avoiding learner input. D. Assigning memorization drills. 32. Which adult learning characteristic emphasizes self-directed study? A. Dependence on instructor. B. Autonomy. C. Rote memory. D. Indifference. 33. Which type of evaluation determines if a training program achieved its intended outcomes? A. Summative. B. Formative. C. Diagnostic. D. Informal. 34. Which communication element ensures accuracy in interdisciplinary teams? A. Standardized handoff protocols. B. Informal note passing. C. Casual conversations. D. Ignoring feedback. 35. The best strategy for curriculum revision after new transplant regulations are introduced is A. Continue old material. Align learning objectives to new standards. C. Ignore changes. D. Focus only on clinical skills. 16. Which communication barrier most affects transplant education? A. Cultural sensitivity. B. Medical jargon overload. C. Patient motivation. D. Coordinator certification. 17. Which mentoring practice supports knowledge retention in clinical coordination? A. Encouraging reflection. B. Providing only oral lectures. C. Assigning random tasks. D. Ignoring learner questions.